My name is Sarah Westgate, and I'm the manager for assisted living integration. I have with me today some really key people. So I have Emily Pridham, who is the director for the COVID response for long-term care and assisted living. Marina Lang is our clinical nurse educator for long-term care. And I would also like to introduce Carmen Bentley, one of our infection prevention and control practitioners, as well as Carmela Veza, who is a director for long-term care and assisted living. So welcome today. Before I go too far, I would like to pause, and I would like to acknowledge that I am in fact an uninvited guest on the traditional and unceded territory of the Malahat First Nations. The Malahat are part of the Coast Salish First Nations, and I would like to express my great personal gratitude to the Malahat people and all Indigenous people from this beautiful territory. So what I want to start with today is letting participants know that today's session will be recorded. And the reason that we wanted to record this session is recognizing that many of you work different shifts, and we're hoping that all the greeters will have an opportunity to see this session and see what questions come up and hear the information, and just have a little bit of a refresh in terms of the role of the greeter and how valuable our greeters are in keeping our long-term care and assisted living residents safe. So this session is being recorded. So generally what I want you to know is that you have the ability to change the name on if you've logged into this Zoom call. If you go up to your picture and go up in the top right, you can actually change the name on there, and that would make you anonymous in terms of the name that's shown. And also, if you would like to, you can turn your camera off, although we would really prefer you to keep your camera on so we can see your faces, because we really like getting to know people and see them and talk to them. We will also just let you know that if you wanted to ask a question that is not already being addressed, you're welcome to put it into the chat. So if you hover your mouse down at the bottom of your screen, you'll see a little symbol, like a message symbol, and it says chat. And when you click on that, you have the option of sending a message to everyone, or you can select from the drop-down menu. You could just send a message anonymously to Emily Pridham, and then Emily would be able to say your question out loud without me having to say your name and everybody knowing kind of where that question came from. So I just wanted to let you know that your privacy can be protected in that way, and we hope that you will stay and continue with this session. And that's all for me for now. I'm just so excited to have everybody here. What I'm going to do is turn it over to Emily Pridham to just give us some opening remarks before we start.
Thanks so much, Sarah, for that lovely welcome and introduction. I just wanted to thank everybody for taking time on this Friday afternoon for joining us for this great discussion that we'll be having about greeting and screening in long-term care and assisted living. We've been doing this for a long time. We've been doing this all throughout the COVID-19 pandemic, and it's really one of the critical cornerstones of keeping COVID-19 out of our building. That said, the process has changed quite a lot over time. I know that quite regularly we send you updates with new procedures, new guidelines and changes. Every time something changes in the orders that we get from the Provincial Health Officer or the Ministry of Health, our team, especially Marina and Sarah, do a lot of work to make sure that the way we're screening people coming into long-term care is consistent with what the province expects and what we know will really make a difference. So I really encourage you to engage with the session today, ask whatever questions you might have about screening. This is really your opportunity to connect with our team and also with each other, and focus on what screening is looking like coming into the fall, where we are still seeing COVID-19 circulating in the communities and also seeing other infectious diseases as well. So the screening is really a useful tool to make sure that everybody coming into long-term care and assisted living is well when they do. So I think I turn it over next to Marina. Is that correct? Marina, over to you.
Thank you, Emily. I'm just going to start a screen share here for the PowerPoint presentation. So that should now be up on your screen. So welcome everybody, whether you're joining us as a long-term care or assisted living home leader, or you're a greeter yourself. We're happy to have this session for you today. It certainly has come up in the last couple of weeks that a session with a greeter focus was of great interest, and we're happy to be able to provide you with the content today. Perhaps a little caveat is that the content we're presenting today is current as of November 5th, 2021 at 1:08 p.m. We do know things tend to change a lot. However, with a lot of the orders that have come into play most recently, it seems like, October 26th was the big date for long-term care and assisted living programs, and we're hopeful that things have settled a little bit and we've got a bit of stability with regards to greeters and the important role that you play in long-term care and assisted living. So for today's presentation, we've got a few objectives to go over now. We're giving the highlights and key features of greeters and the role in general. There are a lot of specificities to this role that are to your particular site or how things are set up, but this will give you a really great reminder of your importance and your job and the goals of your work, as well as maybe a few more opportunities to learn something new to how to expand your role within the guidelines that we're following. So we'll be looking at some of the key principles. I'll go over some of the best practices that greeters should be aware of, including masking and use of alcohol-based hand sanitizer. We'll go through the orders from the provincial health officer that are really the guiding factors on this work, and the sort of job description and pieces that we put into play whenever they're updated. We'll talk a bit about proof of vaccination status, as that's one of the newer elements to your work. I'll go over some pearls of temperature checks, and we'll talk a little bit about contact tracing, the important elements there, and the information that's received in that manner. So greeters, as you know, are the first point of contact for everyone entering our site, whether they're long-term care or assisted living. And being the first point of contact definitely has its pluses. You get to be, that smiling, welcoming face that set the tone for the person's visit. But there definitely are cases where you might be the only point of contact for people coming to the building, which means you might also be on the receiving end of frustrations and complaints that are coming in. So with that in mind, it's important to know to maximize your interaction in terms of being able to follow the screening procedures and provide some information about how to visit safely or how to conduct oneself safely while on the site. It's also important to know for your site how to contact people, whether that's site leadership, or be able to call for assistance if needed, should an interaction escalate in a way that doesn't feel positive or safe for you. So those pieces will look different at each site, but it is important that you have that understanding of how to get help and support when needed. One of the key cornerstones of a greeter is that active screening process. And so the key word there that has been consistent from the ministry is active. So this means this is a conversation between the greeter and the person entering long-term care or assisted living, and going through key questions to determine whether the person is safe to come into the building and reduce the risk of transmission of communicable diseases. Greeters may also be a source of information for visitors to the site, for how to perform proper hand hygiene, mask etiquette, whether that's how to put on and safely take off a mask, when to wear the mask while you're in the site, and where they can be safely disposed of, as well as safe visiting practices for your sites. Each site should have a visiting plan about where visits take place, whether that's in the resident's own room or a designated visiting space, as well as some visitor conduct in terms of going directly in to the place that you're visiting and coming direct out, and minimizing any contact within the site. Greeters are collectors of required personal information. So the information that's collected, it is required by the ministry under order, and we'll get into those details a little bit more. And it's the responsibility of the greeter to maintain the confidentiality of the information that is being collected. So ensuring that clipboards are and forms are completed by the greeter rather than being a front-facing form that everyone can see who signed in previously are some of the ways that confidentiality can be maintained, as well as where those records are stored for a period of 28 days afterwards. So in long-term care, we have our screening tool, and it's an algorithm setup, and it's basically asking 3 key questions. And at every question, if the answer is yes, that is a hard stop, and the person is considered not safe to enter. You don't need to go through all the questions if they've answered yes and complete the screening and contact tracing. If you've come to a stop point, that is when you're directing the visitor to return home or consider self-isolation and seeking testing because they've indicated they might have symptoms. On this tool, the first question is really asking, are you allowed to be out of the house right now? Because it's asking whether a person has been instructed to self-isolate from public health, whether they've been mandated to quarantine based on their international travel. That piece for quarantine is now determined at the point of entry to the country and isn't the broad sweeping federal mandate that it once was. As well, if based on any lab results they might have had, they would be advised to be staying at home for a particular period. The second question is asking, do you have any signs of a respiratory or gastrointestinal illness? Now, keep in mind that a person doesn't need to have all these symptoms. In long-term care and assisted living, because of our populations that live in our homes, we do need to have a very low threshold for symptoms and testing for people that do come into our facilities. We ourselves wouldn't be testing people, but we are advising that people don't come in if they have any single symptom, however mild. You will notice when it comes to cough, it's a new or worsening cough. We do know that people live with chronic conditions where cough might be part of their normal condition, but it's whether or not that cough has gotten worse or is new to them is the key decision point there. The third question is really about exposure risk. And so there are people who, based on case investigation, will have been advised based on their exposure risk to seek testing. So if that's the case, then this person shouldn't be coming into our facilities because they've had a significant exposure and would be under a 14-day self-isolation. When this first phase of questions is being asked, there's no personal information being collected or recorded. These are really the first 3 safety checks before a person goes through to the next phase of testing. It's also important to note that when we're speaking of screening, we're screening all people except for emergency responders if they're coming to the site to attend to a 911 call. For the second part of testing, this is where we get into, we've determined that yes, they can come into our site, and now we're getting more information about their vaccination status, advising and supporting people with their hand hygiene, putting on a mask, and then performing that final step of temperature check. And that temperature check is sort of the last stop, that if the temperature is out of range, and it's at that point that a person may be turned around to seek either testing or staying at home until they feel better. Sarah, I'll let you go through the assisted living screener tool.
Thank you so much, Marina. And I feel like that's a bit of a tough act to follow, but I will try to I will try to explain this screening tool. One thing I just wanted to mention before I start is that, you know, what we've become aware of through the pandemic, and what I've become aware of since I started in my role almost a year ago, is that there are a number of sites out there that are like a village or a campus of care or a cluster care. So there are sites that have one single entrance, and then inside that building, they have assisted living and long-term care residents. And in some cases, they have independent living residents as well. And that, has created some challenges. So I just wanted to mention that for cases like that, it is completely fine to be using either the assisted living screening tool or the long-term care screening tool. The content is exactly the same because it's based on the same provincial health orders. And I don't mind if you just like the long-term care one better with the algorithm and the stop signs. It doesn't matter. It doesn't hurt my feelings. So just wanted to mention that there's some flexibility. And I'm also aware that some organizations, some larger groups especially, have developed some of their own screening tools. And that's fine too, provided they align with the provincial health orders. So there is a lot of flexibility, and the screening tool that you're using might look a bit different than this, but the elements should all be the same. So with the assisted living screening tool that's been developed, the first few things are in a slightly different order. So we start with symptoms. Obviously, we would never deny entry to a resident, even if they're symptomatic. And I just want to speak about that too. So lots of people have asked me, do residents need to be screened? And the answer is no. Residents live in the building. They don't need to be screened. But if they've been away for a few days and they're willing, you can screen them. And the direction is that if they have symptoms or if they're sick, you should let the operator know and give the resident information about how to potentially seek care from their healthcare provider, and also call to arrange for COVID testing. So the assisted living screener starts with symptoms. We ask the same question: are you under order to quarantine after travel outside of Canada? Have you been told by public health to self-isolate? Has COVID testing been recommended to you? And then again, when in the case where residents have been away for a while, then we look at how to support residents in that situation. Do you want to go to the next slide, Marina? Thank you. So then there's sort of 3 steps for the assisted living screening. So step 2 is the temperature screening. Hopefully that's pretty quick and easy. You've probably all done it about 1,000 times by now, and you've got your thermometer and you record the temperature. Obviously, anyone aside from a resident would not be allowed to enter if their temperature was abnormal. And then in step C, confirming the vaccination status. Again, you're looking at what type of person is this who's coming to the building. Is this a visitor? Is this an outside healthcare provider, like someone from Island Health, a community health services worker? Is this a delivery driver? Are they there regularly? Are they there occasionally? So you kind of you ask the question, can you provide proof of vaccination and photo identification if they're 19 plus? And then depending on which category of person it is, that would be the answer that they need to give so that they can proceed into the building.
Thank you,
And
Sarah.
I just want to pause there and see if any questions are coming up for people. Okay, so yeah, we can move on then, Marina.
Wonderful, thank you. So with your role as a screener being such a great touch point for teaching practices around ABHR, I'd like us to go through together, and I'll demo with my hands, but it's also helpful for you as participants to follow the same directions, just to get a feel for all these different steps. I know that when I first started teaching how to properly use ABHR, I realized myself that there was a couple in here that I wasn't doing routinely. The important thing to know about ABHR is how it works. So because of alcohol, it needs to be 70% or higher in order for it to be effective. What it actually does is viruses have a phospholipid bilayer. There's a really great word to throw out at a dinner party, a phospholipid bilayer. And what the alcohol does is through dehydration of that bilayer, it breaks open the cell and deactivates it. And the length of time it takes for that to happen is the length of time it takes for the alcohol-based hand sanitizer to evaporate. So your hands aren't clean until they're dry. And studies have shown that hands with wet ABHR on them are capable of transporting and transmitting germs or bacteria because that process for breaking them open and inactivating it hasn't occurred yet. So Wet hands are considered dirty, dry hands are clean. And different products are going to take different lengths of time. Roughly, it's about 20 to 30 seconds for that, which can feel like a long time when you're standing outside the door trying to get in. But that dry time is really important to the effectiveness of the ABHR use. And some products, whether it's a gel-based or a liquid, might have a different evaporation time. So generally speaking, people are putting 2 pumps of hand sanitizer in their hand. You first start by rubbing your palms together, and friction's an important part of the deactivation and dehydration process as well. And then you go over to the backs of your hands on each side to get those behind surfaces. And then moving in between your fingers, you're rubbing up and down the length of your finger, and then flipping over to get the back sides. This is my favorite one, the thumb twist on each side, because that gets the base of your thumb and the length of your thumb. And then kind of rubbing your fingernails on the palm, that works some of the ABHR up under the nail and works on what might be living underneath your nails. And then finally, you're bringing what's left down on to your wrist to be able to work the ABHR down below the level of your wrist. And then you wait for it to dry. So roughly about 30 seconds. And this is something that, you can go through with visitors when you have the time. I realize sometimes there are lineups, but it's a great point for the effective use of ABHR. Signage like this should be posted as well near your stations, just to be able to help guide people visually as well. When it comes to masks, there are, points for us that we're very much aware of working in healthcare about masks and how to safely put them on or off. But these may not be as well known to our general public. So being able to instruct people how to put them on and how to dispose of them safely is another piece of reducing transmission on your site. So you always want to make sure your hands are clean before donning any PPE. And when we're using our masks, it's the color side. So the blue side is facing outwards if you have a 2-color mask. When you're putting on the mask, you want to make sure it's going over the center of your face and it's being put on with the loops that are going over the ear and getting that good fit over the nose with the wire fitting piece on the front. When we're thinking about that mask on our face, the outside of the mask is considered the hot zone or the dirty zone. That's where germs, viruses, bacteria, dust, dirt from the environment is going to be sitting on the outside. Medical grade masks have a waterproof layer between them. So what sits on the outside doesn't come in, and vice versa. Your droplets from your mouth will stay on the inside. It's important to have a good fit across the nose and at the sides. We do talk a little bit about fit when we think about our younger visitors, because adult-sized masks on children's faces do not offer the same fit. And so we really want to be looking at a proper fit for those reasons, to keep droplets encased as much as possible. Anytime, and this goes for us, this goes for anybody, anytime you touch the outside of your mask, you need to wash your hands, because everything that's on that outside, you can now rub into your eye, rub onto your computer mouse, rub onto the door handle. So being aware of, if you do touch your mask, we all do it, that is a point to wash your hands. When we're taking off the mask, because we need to put our hands to our face, again, you want to be doing this with clean hands. So washing your hands beforehand, using the loops at the back to remove the mask and keeping that dirty side out. The mask can then be disposed of in a garbage can and hands washed again. So who wears a mask? We know that we are under, as healthcare workers, there's a mask policy in place for healthcare workers currently that we all must wear a mask, regardless of our vaccine status. When we're thinking about visitors or outside people to our sites, all people 12 and older must wear a medical grade mask, and the masks are provided by the site. The age group of 5 to 12, so there is currently within the school systems, this age group of people would be wearing a mask for school. So it's considered acceptable and recommended in long-term care and assisted living that this group would also be wearing a mask. When we're talking about children, though, it's more about the mask and how it fits. So if your site does have pediatric masks and they offer a good fit for the child, then that would be preferred, a pediatric medical grade mask. If for some reason you don't have those, or they're just not providing a great fit, if the child is coming in with their own face covering that has a good fit, that's permissible in the under 12 group. For our little folk between the age of 3 and 5, masking is tolerated. This is not something that they might not be used to, and a young child sort of fumbling with a mask is going to prove to be potentially more of a transmission risk than a child with clean hands, no symptoms, and not sort of touching their face the whole time. And we do know that due to safety reasons, masks for the under 3 group are not recommended. When it comes to visitors, so when I'm speaking of visitors, I mean people that are coming in to visit specific residents. If they are fully vaccinated, and the definition of fully vaccinated is having had 2 doses and they're 7 days from their 2nd dose, they may remove their mask when they're in the private room of the resident that they are visiting, or if they're outside. But while they are going through common areas or hallways, or if they're not the only 2 people in that room, then masks need to be on. If during the course of a visit, staff need to enter the room to provide care to the resident, then this is no longer a private space because staff have entered, and visitors will be asked to re-don their masks in order to maintain safety for staff entering. For each of your roles at your sites as greeters, there's some things some pieces that you should know that are going to be specific to your site. So sites will have visiting hours that are staffed by greeters, and should have after hours visiting plans as well for how people may enter the site. If there's a vigil going on for someone who is palliative or end of life, or if other arrangements have been made for after hours visiting. You should know the designated visiting areas of your site, be able to direct people how to get to them, and how they're used or booked depending on your site process, and what considerations are in place for safety for visiting in multi-bed rooms. The ministry does offer recommendations around that. The preference is that visiting is happening in private rooms or designated visiting spaces. Room occupancy limits. So depending on where visits are happening, we know from WorkSafe BC and the communicable disease plans that all homes need to have, is that room limits need to be adhered to as well, just to make sure there's enough space for people in any one area. As a greeter, you'll need to know where your ABHR and mask stock is located so that you can replenish your supply at the front door, as well as know if your site has an area for outdoor visits that do not require entry through the site. An area for this may be used for visiting with unvaccinated visitors. This group of people still needs to be screened because just for monitoring exposure risk, we still need to know that unvaccinated visitors are asymptomatic and need to be provided with a medical grade mask. So the big piece that we've mentioned is the provincial health orders. And if you thought there was lots of changes and it was really confusing, it's no wonder why, because your work is actually informed by 3 different orders and 2 guidelines, which are under order. So the first order is the Visitation and Visitor Appeal and Review Order. And this order came into effect February 5th and has no end date. And within this order, it tells us the Ministry of Health overview of visitors in long-term care and assisted living must be followed. This guideline has been updated very frequently. The last update was October 12th. And so as that guideline is updated, we know we have to follow it because it's under this sort of parent order here from February 5th. Within that visitor overview from the ministry, it further says you need to follow the infection and prevention and control guidelines for long-term care and seniors assisted living. So these 3 together form a package of a lot of the criteria that we're looking for in a screener. The residential care COVID-19 vaccine status information order speaks to who we're collecting information from, and that we are allowed to do that from not only staff, but visitors to the site, whether they're contracted to work there or an outside healthcare provider. That's where that piece comes under the order. And then finally, the COVID-19 preventive measures order speaks to measures in place to support staff on site. This is where point of care testing came into play. And at this point in time, all staff must be vaccinated. There's a small group of staff that received only one vaccination before October 26th. And this group of staff may enter the site provided they're getting point of care testing. I do know that many sites, greeters are the point of care testers. That's not the same, across all sites. So if you aren't the person performing the testing at your site, it's also important to know what that looks like and how to support the testing when somebody presents who needs it at your site. So with all those orders and with all the changes that have happened, it really comes down to this. And I've come to a place now where I really just want to know the exceptions, because it's easier to remember the exceptions than it is to remember all the rules. So right now, effective October 26th, all staff, visitors, outside healthcare providers, outside personal care and support providers must be fully vaccinated to enter. There is one exception for staff that we've spoken of. It's those people who have had one dose. And then we have our exceptions. So emergency responders attending a 911 call, they don't need to be screened. They're coming in, they already have their own screening processes through their own work. And when responding to a 911 call, time is heart, time is brain. They should not be delayed at the front door for screening. The only group who may enter the site without full vaccination is the occasional other outside provider who do not have close contact with the resident. So occasional means this person is not present at the site on an ongoing basis. Outside providers include people like entertainers or maintenance people. And then close contact is defined as being within 2 meters of a person on site for 15 minutes cumulatively in a day. So we have very clear definitions here about who's going to fit into that category. For this group, if the person meets that definition, they may enter the site. They still need to go through the screening process, but they may enter without full vaccination. They must wear a medical grade mask for the duration of their time on the site, and they must maintain 2 meters physical distance from all people. Children under the age of 12, there's currently no vaccination that's approved for this group, nor is it mandated. So children under the age of 12 do not need to show proof of vaccination. And people with an approved medical exemption. So there is a provincial process now for getting medical exemption. The language on the forms currently is for staff, but it's our understanding that visitors, if they are seeking a medical exemption, would follow the same process. And then unvaccinated people who have an approved safety plan in place for critical illness or end-of-life visit. So there is language to support end-of-life visits. We'll get into that a bit more on the next slide for people who are unvaccinated. But in order to do that, it needs to be approved by site leadership, meet the criteria, and a safety plan in place. So this is a snip of the algorithm for your information about what goes on in the background to support a palliative or end-of-life visit. We can send this out as an attachment. Don't try to read this because it's going to be blurry. But really the criteria are whether the resident has a critical illness or significant life-threatening condition or health change event, if their condition is considered end of life and death is anticipated as imminent, or the resident has plans for medically assisted death. If any one of these criteria are met, then a visit is permitted. And then there's a list of actions in place for site leadership to put into place to support the visit of an unvaccinated visitor for the residents who meet this criteria. So proof of vaccination status is relatively new in long-term care. Before it was a little more casual in terms of what people could provide us. With the latest rendition of the orders, we know that people over the age of 19 need to show their proof of ID, whether that's their QR code or their paper record from the vaccine clinic. And they also need to have a validated ID with it as well. When you get somebody's proof of vaccine, the same system is in place that you can record their vaccine in your logbook. And that way for future visits, if a person forgot their proof of vaccine, you have a record of it at the site and can support that visit knowing they're fully vaccinated. QR scanning is becoming more popular. It's definitely something we see out in our restaurants and things. Many of our sites also have iPads for the QR scanning purpose. Just know that QR scanning, it's not part of the requirement. It's a tool used to validate. But if that's not something being done at your site, that's okay. Just making sure that we're getting photo ID for people age 19 and over. And we do need proof of vaccination for 12 and above. They just wouldn't have ID to go along with it. So photo ID includes anything that's government issued and has a picture. So examples include the BC Services card or a driver's license. Proof of vaccination may be electronic or printed. It must be issued by the government or a vaccine clinic and must have the name of the holder. The name of the holder must match the name of the photo ID. And there's just an example here of what you might see when you are if you're using the QR code. There's 3 options. The person will come back as fully vaccinated, partially vaccinated, or no information. When we were speaking about the visitor vaccine log. So this might be something you're keeping at your site as sort of a master binder of vaccine status for visitors. It can be organized by resident name, and then you would look up the resident and see all their visitors who have demonstrated proof of vaccine. First, last name, and their vaccination status would be required, as well as the person who validated that, that proof of vaccine. Temperature check. So like Sarah mentioned, you've probably checked about a bazillion temperatures. There's a few things just to remember, as you know, when you kind of repeatedly do something, it can get a bit mundane, and maybe you become less aware of the actions and the safety behind it. So when whoever you're checking the temperature of, because in order to do that, you're getting into that person's space, they need to have the mask on. As a greeter, the current recommendation continues to be that greeters are wearing eye protection and a mask. Just a few notes about the winter months that we move into. So this can really affect temperature readings. So if the person has come in from outside and it's really, really cold, you might get a strange reading, or it might not be able to be read at all. You also might get warmer than usual readings if a hat or toque is being worn that's covered the forehead. So you might find that you need to, do a couple readings in order to get a result that you feel is accurate. When you're going over the forehead for a temporal temperature, slow and steady is best. You're following the veins and arteries from the forehead down to underneath the ear, and the thermometer needs time to accurately read temperature along the way. And then for tympanic, so those are temperatures happening in the ear, the angle is really important. What the temperature is reading is actually off the eardrum. And so the angle of the little probe is really important for an accurate reading. And finally, for contact tracing information. So this is should be completed by the greeter. Visitors shouldn't be signing in, because then they'd be able to see all the information of the people before them. What's needed, and so whether you're using an Island Health form or your site's own form, the key elements that are needed are first and last name and the contact's phone number in the event there's a public health investigation and their time on the site was considered an exposure risk. As well, it's important to denote vaccination status on this form, because that really helps with the case investigation process, determining risk, because there's a different risk profile for people who are exposed and vaccinated versus people who are exposed and unvaccinated. And this is just an example here of the Island Health sign-in sheet showing those components. Keeping the date and time is also helpful for when if you need to go back. These forms do need to be kept for 28 days and kept in a confidential location, but should also confidential yet available should they be needed for public health or contact tracing. And that's it for me. So if you have any questions, we have about 15 minutes here within our time together. You can also send questions into our resource mailbox, which is ltccoach@islandhealth.ca. Thank you.
Thank you so much, Marina. I was sort of following along when you're doing the hand washing, and I actually did not know about the hand sanitizer needing to be dried. So I can already say that I've learned something critical there, and I'm sure I'm not the only one. So thank you so much for that very detailed presentation. I had some questions pre-submitted, and so I wanted to thank everybody who took the time to do that. So we've got 11 questions that we can go through. There is a question in the chat, however, that we can start with, and it says, is it acceptable to take a temperature at the wrist?
So that really depends on, so yes, it is. It just depends on the temperature, or the thermometer rather, that you're using. So there's lots of different brands out there. Just make sure you're following the correct steps within that particular brand of thermometer. There are some infrared ones that do take a reading from the wrist.
Perfect, thank you.
And Sarah, before you go into the pre-submitted question, there's one that was sent to me directly. So I'd like to ask it so everybody has the benefit of the answer. So someone has asked, do doctors need to show proof of vaccination?
I love that. Yes, they do. Doctors are outside healthcare providers, and they are not allowed to be in your facilities unless they demonstrate proof of full vaccination and show their photo ID. So doctors are not exempt in any way. Another question, what about existing staff getting the first dose after October 26th?
So they'll have been on either an unpaid leave up until now, or technically terminated, but anyway. So if they can't be on site, if they haven't had their first dose, and they can't return to the site until they're considered fully vaccinated, which is 7 days after their second dose, if they've had their first dose after October 26th.
Thank you. Emily, was there any more other questions before I go into the ones that were pre-submitted?
No, there's not, but just a reminder, if anyone would like to submit a question or comment anonymously, you can send it to me and I'll read it out without saying your name.
Perfect, thank you. The next question is about PPE. So the question is, how much longer do the screeners have to wear their shield?
So that's a question that's routinely reviewed by our infection control and occupational health and safety groups, as well as looking to the ministry as well for guidance on this. We know that the point of care risk assessment for the role that the greeter does and the tasks that they perform hasn't changed. So because you're getting within the space of somebody, we'll have a mix of fully vaccinated and unvaccinated people. The current recommendation is to continue with eye protection and a mask. It is under review currently right now by infection control and OC health, so we may have an update for you on that. But for the time being, continued use of eye protection and mask is what's recommended.
Thank you. Maybe I'll take one more pre-submitted and then go to the chat. So just a comment about communication at Island Health. Just a comment that many Island Health staff seem to still not be aware of the Provincial Health Order and proof of vaccination. And I just want to thank you very much for that comment. I agree. Community Health Services employs thousands and thousands and thousands of people, and lots of regular staff and lots of casuals as well. I am tasked with communicating out when things change, and the message doesn't always filter down. So I just thank you so much for your patience and your professionalism. Please report any concerns to your supervisor, and operators and managers should feel free to reach out to me if they're encountering any difficulties. Going back to the chat, question about with the Nanaimo hospital outbreak right now, should a rapid test have been done when a resident comes back from the hospital?
Ooh, that's a good question. So our current guidelines for clinical access to long-term care are based on isolation based on vaccination status, and there's no need to isolate somebody when they're returning from hospital. There's no place right now for testing asymptomatic people. So if the resident does not have any symptoms of COVID, a point of care test wouldn't really offer much information. So if the resident's fully vaccinated and is returning from to your site, they don't require that isolation. However, if they do demonstrate any symptoms of illness, it would be early isolation and early testing if symptoms present.
Thank you. Another question, what is the expected duration of the greeter position? Is it spring of 2022 or longer? All we know right now is that the positions are funded until the end of the fiscal year, which would be March 31st, 2022. And the Ministry of Health usually lets us know as things change. Another question from the chat, when as a staff member, you got flu symptoms, but you're not sick, do you have to stay home? Flu-like symptoms can last for 6 weeks.
So if you have any symptoms, you should be getting tested. And depending on that test result, like, we're not just worried about COVID any longer, and sort of our other communicable diseases sort of took a second rating with this COVID virus that we've been working with. But the diseases that are communicable, like RSV and influenza, are just as threatening to our vulnerable residents as COVID has been. And so the recommendation is that you are not coming to work if you have any symptoms. The only caveat is if you've tested positive for COVID-19, you've done your 10 days of self-isolation and no longer considered infectious. If you have a persistent cough, in that case, a cough post-COVID is known to persist for weeks to months afterwards, but you're no longer infectious, then you may come back to the site. But no, if you're having any symptoms of illness, you should not be coming to work.
Thank you. So another question, at one-time visitors are permitted to enter the facility if not vaccinated, if they're there once a month or less, what is the time limit that they are allowed in the building? For example, if an unvaccinated mover who is a visitor came in the building who was able to keep 2 meters from all staff and residents, how long would they be allowed to be in the building? I think that there might be some confusion here, and a visitor is actually coming for the purposes of like a social visit with the resident, or if they're an essential visitor, they're part of the care team and they're providing an essential piece of care. Someone who's a mover is actually not a visitor. They would be an other outside provider. And if they were there occasionally and they did not have close contact, which is defined by 15 minutes cumulatively, then they would be able to enter the building with a mask on after having sanitized their hands if they pass screening for the purposes of doing their job. So a mover is not a visitor. Question, what about funeral home personnel who are not wearing full PPE after answering yes to having been in contact with a COVID positive patient?
I'm trying to wrap my head around that one. So there are protocols in place for funeral home staff and for any healthcare staff who are handling the remains of a COVID positive person. And with those protocols in place, the person for that task, the proper PPE should be used, as well as proper procedures for how the body is handled. So if that is happening in the course of their work, that's not considered an exposure to a COVID positive person because of all that PPE that's been in place for their task around handling the remains of someone who was COVID positive. We do know recently that clarification came from the ministry regarding funeral home staff. And so funeral home staff are part of the other healthcare provider category, and they do need to be fully vaccinated to enter the site. And at bare minimum, when on the site, would be wearing a mask per the mask policy, but based on their procedures for their work, may need to don extra PPE to perform their work safely.
Thank you. I think Emily may have had another anonymously submitted question. Did you want to pose that, Emily?
Yeah, thanks, Sarah. There's a great question that's been submitted about exemptions, and the question relates to a visitor. So I'll read out the question. There's a visitor who has submitted an exemption from her doctor due to the allergies she experienced from the first dose. Does she have to wait for an answer from the MHO to visit her mom? She's a daily visitor. And I think I'll couch my answer by saying that the response I'll give you relates to what I know to be true for staff who have exemption requests in process. I believe the same to hold true for visitors, but we haven't heard that definitively. So we'll, if something changes afterwards and we find out more information, we'll be sure to let you know. So the process for exemption involves a person going to their doctor and explaining there's only a couple of reasons that people could potentially put forward a request for exemption. That gets submitted by their doctor to the Provincial Health Officer's office. Once it's been received by the Provincial Health Officer's office, the person is providing a notice that the request for exemption has been received. But because it's been received doesn't necessarily mean it's been considered yet. So there's a difference between the notification that they get that their request has been received and the notification they may get later on saying that it's been considered. And it's not until the staff person, and I assume the same would apply for visitors, has a notice from the Provincial Health Officer's office saying that their request for exemption is being considered, that we would look at potentially allowing a visit with other preventive measures in place. These are very rare. We know this week for staff in the Island Health region, so all of Island Health, there are 4 requests in progress being considered by the Provincial Health Officer's office. So knowing that these are rare, what I will offer to you is if you're in this situation with a visitor, please reach out to me and I'll seek some help for you in terms of how to handle that request for a visit and what guidance we can get. We can reach out to the medical health officer directly to try and figure out what to do in those circumstances. If you do have a visitor who has a notice that their request for exemption is being considered. But like I said, if it's just been received, we have to treat them still as unvaccinated until we know that it's being considered.
Thank you. Question about out of province vaccine cards or international vaccine cards. And the question is really, can more information be provided about which vaccine cards or other paperwork are required? This is a tricky question. I think the thing is that what we're looking for is something issued by a government of the jurisdiction that the person is in. And so, yeah, you might not have the ability to do a QR scan of somebody who comes from Alberta. And again, it's not required. If you as the greeter think that that looks legit, it looks like it's from the government of Alberta, then you can accept it. And there's, you're not accountable if somebody comes and they've actually gone to the measures of getting a fake government of Alberta vaccine card. You're not accountable to verify that. I think that's our best guess, is if it looks legit, it looks like it's issued by a government and there's 2 doses, then you can admit them. Another question about eye protection. What if the greeter works behind a huge screen with a small cutout for temperature taking? Does the greeter still have to wear goggles?
I think in those cases, that's quite site specific with a setup like that. So working with your infection control person or getting support from our group here to make sure that's an okay piece that might be set up individually at a site, but the overall guidance is that eye protection needs to be worn by greeters.
Thank you. Should greeters be giving everyone who comes in the door a fresh medical mask? I would think we do not have to supply masks for island health staff.
So the provincial order is clear that the sites are providing the medical grade masks to the people that are coming onto their sites. And so two pieces, that they're providing it and that it's, you know, new on arrival, because you want to make sure that that you're clear that the mask is of a medical grade and that it's clean to prevent any further transmission or misuse of a dirty or damaged mask.
On a related note, I'm curious, Sarah, I don't know the answer to the question. For the community health service staff coming in, are they provided medical grade masks by their employer, by Island Health, before they go to work?
Yes, they absolutely are. It might depend on where the staff member starts their day. There are some CHWs who start their day at an assisted living site, and they would start by going there and going to huddle. So it might be the site that gives them their mask. I would say either or. I mean, they'll know if their mask, like you should be, you know, changing your mask after you eat, and if it gets soiled, like there are circumstances, even when the employer has provided the medical grade mask, where another one is warranted, and the sites do need to provide. Question, greeters in assisted living still do not have to screen visitors or family who takes tenants out unless they come into the building. Yes, that's correct. If somebody's just waiting outside in the car, you don't have to go out and screen them. Do you expect there'll be another form of proof of vaccination with the 3 booster shots happening now?
So right now, the definition of full vaccination is 2 doses and being 7 days from your second dose. The booster isn't part of the mandated language yet. It's just the first 2 doses. That, you know, that could change as the booster program rolls out further, but currently with what we know now, boosters are not considered part of the mandate, and I imagine as things evolve with that, we might see some changes.
Thank you. AL tenants who return from daytime outings do not need to be screened. That's correct. AL tenants never need to be screened, but if they've been away for a couple of days, you can offer them screening, and it's their home, so you don't need to screen them, but if they wish to be screened, that's fine. Question, when a resident is awaiting long-term care placement and has been in the hospital for 1 or more months and are unvaccinated, do they need to isolate? Yes, they need to isolate for 14 days if they're partially or non-vaccinated upon placement into long-term care or assisted living. What if the resident is traveling out of province with a family? Is there a timeline how long the resident can go and are allowed to travel out of the province? And do they need to isolate for 14 days or a rapid test? When residents are away from their facility, they do not need to have another isolation unless they've been hospitalized. So there's 2 circumstances when residents would do a preventative isolation who are partially or non-vaccinated, and that is upon admission or after a hospitalization, but not if they've just been staying out of the province or wherever. They do not require another isolation. The Q code does not indicate if someone's vaccinated ×2 plus 7 days. Should greeters be asking when the visitor had their last shot or ask for proof? And if so, what proof?
So that is correct. That's one piece with the QR code. It doesn't provide the date. My understanding of using that tool is that if you get the fully vaccinated signal back, that is considered proof of vaccination, and just connecting it with their photo ID is you've met both criteria from the ministry.
Super, thank you so much. Unfortunately, I'm going to have to close the meeting. It is time, and I have another meeting to go to. There's just a couple questions that we didn't get to, but we'll send out the answer to the operators. So thank you so much, everyone, for your time. Really appreciate it. And thanks for doing the great job that you're doing in long-term care and assisted living. Bye for now.